National EHR with Healthy PIN is a policy proposal that can reduce healthcare costs and increase access to healthcare diagnostics. So on the next slide, I'll elaborate that EHR is electronic health records. Currently, different organizations use different EHR systems, which drives up administrative costs. US healthcare is primarily costly because of administration. So, a national EHR can reduce expenses by cutting down on blue. Additionally, a medical ID app with QR code will connect patients, providers, and responders to this EHR and their health records. So, this medical ID app will be called Healthy PIN. It allows patients and medical professionals to read and update data from a central repository without needing to pull them up, carry them around, or transfer them from one provider to another. The more efficient system provides patients and healthcare professionals with a single source of truth in accessing up to date healthcare information. This comprehensive view of a patient's healthcare records will facilitate easier diagnosis, cross impact of various drugs, and communication between patients and healthcare workers. Combined, National EHR and Healthy PIN can create more affordable, transparent healthcare. So, what are electronic health records in their current form? So, EHR are a digital collection of patient health information. These records compile health history, diagnoses, medications, treatment plans, and other similar information. EHRs allow data to be available instantly and securely to authorized user. They're mostly commonly used by clinicians to make diagnoses and prescriptions. Currently, electronic health records serve first to document the care provided to patients. They are legal documents used to establish medical necessity, support quality measures, and support claims for reimbursement. So, we have a twofold problem here. A national unified EHR with a personal medical ID addresses two issues at once. First, reduced administrative costs alleviate healthcare costs as a whole by removing the need to invest and train decentralized provider-based IT systems. We, the US, currently have the most expensive healthcare system per capita, which far outpaces even the next country with the highest expenditure, Switzerland. And we're an outlier in another way. Administrative costs. At $937 per capita, the US spends 4 times as much as the OECD average. Hence, reducing administrative expenses is an excellent way of reducing expenditure. Second, if paired with Healthy PIN, an accessible medical ID, unified EHR can reduce administrative burden and make access to healthcare data easy. Currently, access to information for both patients and providers is a major issue. The lack of access to medical notes in New Zealand conveyed that. Only 52% of New Zealand patients answered that they understood their medications. These issues have been estimated to cost New Zealand 222.5 million NZ dollars per year. This is because medical records are directed towards clinicians, not patients. And on the whole, lack of knowledge and non-adherence costs money, billions of dollars. Not to mention, opaque medical information has indirect consequences for patients. Case in point, fragmented EHR systems make it hard to collect data for studies. Another scenario, medical ID can help out with emergency care. Responders require rapid access to healthcare information, and our version of medical ID can do that. So our solution is that the US should implement a national EHR and Healthy PIN to reduce costs and increase access.
It's been like 4 minutes. Yeah.
Oh,
it has
damn.
to be under 3.
Okay, the script is too long then. Okay. I will skip various parts then. We'll have to re-record.
I have no. Wait, what were you talking about for like the. I'm kind of confused because.
Is there a difference between the policy proposal and the script?
Yeah.
Well, crap.
It doesn't talk about like all the research because that's like in the proposal, and I feel like you don't need to talk about that in the video.
Yeah, probably. Okay.
So like.
We must re-record.
Right. We also need to upload it by like 12.
Yeah. Also, where is the script?